Good morning from New York. My name is Aidan Cronin. I'm a senior WASH advisor in the UNICEF WASH team here. And I'm very excited to be able to, and honored to open today's session. I'm involved with the GLAAS work from UNICEF side, and this is extremely important, what we're going to hear today in terms of launching priority gender-specific indicators for SDG 6.1 and 2. And UNICEF have an amazing collaboration with WHO on JMP and GLAAS, and this work is really testament to that. I really want to give a huge shout out to the JMP GLAAS teams and our overall collaboration with WHO. Really are not cousins, but brothers and sisters, I would say. So I don't need to tell you on all here on the call today about how important gender is to WASH programming. You're all well aware of that, and that reducing gender inequalities is a central focus of UNICEF and WHO programs around the world on WASH. So in 2020, the JMP and GLAAS partnered with Emory University to review opportunities for monitoring gender under SDG 6.1 and 2 and to identify priority gender-specific indicators for integration into national and global monitoring efforts. So today we see the fruit of that. Today's presentation really reflects the insights and inputs from an extensive number of experts and stakeholders with expertise in gender, WASH, and very importantly, it provides guidance on practically tracking the recommended gender-specific indicators moving forward. And glad that we have so many colleagues from countries here, and you know, our WASH and gender colleagues in countries have a critical role to play in supporting governments to integrate these indicators on gender international monitoring systems. So we hope today's session will really help us in that respect. Couple of housekeeping issues. One is that we do have interpretation available. You can click on the button on the bottom of your screen to see that. We really want a vibrant chat and feedback session today. So if you have questions, please do flag in the chat box or comments. Really helps to enrich the issues that we will be touching upon, you know, we will be hearing, of course, you will have reactions to the many expert reflections that we'll be hearing from our guests coming in and speaking at various points. So maybe with that, I will pass over to the JMP and Emory team to kick us off and introduce the work. Thank you.
Thank you for the introduction, Aidan. We're really excited to have everybody here to officially launch the priority gender-specific indicators for WASH monitoring under SDG targets 6.1 and 6.2. I've listed an agenda here, which we will follow, but in the interest of time, I will jump right in. And I think it's really important to start by, talking about why we need gender-specific indicators. Well, I think all of us know how powerful gender data can be. It allows us to understand conditions and experiences and needs of populations. With regular data collection, we can see changes over time, whether better or worse. We can see how there might be disparities within and across geographies and populations, and use data to inform evidence-based action and also hold decision makers accountable. And while all this has its benefits, when there is no gender data, it's quite challenging because we have, without gender data, it masks the conditions and experiences of populations, prevents or limits our understanding, hides disparities, and probably the most problematic, it can hinder evidence-based action and relieve those who should be responsible from being accountable for action. So there's a specific need for gender data to monitor SDG 6. And in fact, there's a need for gender data across all SDGs. It's imperative for all sustainable development goals to be advancing gender equality and empowerment. Now, UN Women has considered SDG 6 to be gender blind because none of the primary indicators are gender specific. And what we mean by gender specific is that the existing indicators don't explicitly call for sex disaggregated data, or they don't refer to gender equality as an underlying objective. And the JMP teams know that, as do others. And to that end, there have been multi-stakeholder efforts that have been underway for many years to enable gender monitoring of SDG 6. So specifically, the UN Water Integrated Monitoring Initiative for SDG 6 embarked on a gender contextualization for all of the indicators related to SDG 6. And of course, the JMP, who are the global custodians of WASH data, have been committed for years to improving how gender is monitored, specifically in alignment with targets 6.1 and 6.2. So Emory partnered with the JMP team to undertake the effort to identify priority gender-specific indicators, and this has involved multiple stakeholders and multiple phases over several years. And so what I'm going to do now is talk about that effort and specifically how what we're trying to do with these new priority indicators is, fill this gap from the SDG indicators being in this neutral, unaware, or blind area to having a set of indicators that are sensitive, responsive, and specific. So first I'll talk through the phases of this. In phase 1, we aim to review what information was out there. So we started with a literature review and used that literature to create a conceptual framework for achieving gender equality and equity in and from WASH. This document was reviewed by 11 external reviewers who provided critical feedback for strengthening both the review and the framework. I'm not going to go through all of this framework, but just to note that it's in that document as well as in the final priority indicators document, and that it has been crucial for setting the stage and being a guidepost for everything that we've done that has followed. Starting with our review of tools. As a next stage, what we did is we searched for, collated, and inventoried as many tools that we could find that either focused on gender and WASH explicitly or had elements within them that addressed gender and WASH. We identified 76 tools and created an inventory of these tools. This is downloadable online. We then used the framework that we developed to then categorize the individual survey questions or items from those tools by the domains of that framework. So here you can see this is the sheet on privacy. It has 43 specific items that we identified. And so the number of items is really extensive and ranges from 24 to 239, depending on the specific domain. It's become a valuable resource that we've continued to leverage. Still unsatisfied with our comprehensiveness, we engaged experts at 3 rounds of consultations to help us identify if we had any critical gaps in our understanding of tools and measures, if there were opportunities to leverage any existing data for understanding gender and WASH, and also looking forward if there were any opportunities or approaches that we should consider for collecting new data. We concluded this phase with a final report that summarized all of our learning to date. And really, there were 2 take-home messages. One is that actually we are quite active and have lots of ways of considering how to measure and monitor gender in the context of WASH. However, with so much, there was really a need to identify a priority set of indicators because we cannot measure everything. And it is in this spirit that we embarked on a second phase of work, this prioritization phase. We collectively felt that it was really important in this prioritization phase to really involve multiple stakeholders and bring a lot of voices to the table to think about how we would approach the prioritization and engage the steps along the way. So we first started with a development of a core team. From that, we had the core team first engage in an exercise to review the conceptual model and to identify which domains of this model were the most appropriate for monitoring. So I'll give an example of how we did this. So first, in the consideration of time and labor as a specific domain and in the context of thinking about water specifically, what we did is we had all members of the core team use a software called Power Noodle to provide comments of what they knew and what they thought and what their reflections were regarding that domain. So here, time and labor, and water specifically. Everybody then read through those comments and then in a separate exercise went through and provided scores along certain criteria, including evidence of importance, measurability, potential for change over time, comparability, and usefulness to practitioners and policymakers. We then created spider diagrams to help us visualize how these scores came out and also to aid discussion. So you can see here for water, time and labor, those scores are actually quite strong. In comparison, the team thought that privacy, this is privacy related to water, was not necessarily something that we should focus energy on. In the end, ability to meet WASH needs, safety and freedom from violence, time and labor, and privacy were all included. Now, privacy was not included related to water, but very specifically related to hygiene, sanitation, and menstrual health. From there, we leveraged the tool document that we had to first identify potential indicators or measures for assessing these identified priority domains. And once we had a long list of potential indicators and measures, we sent that long list to over 100 pre-identified experts in WASH, gender, and measurement as a first pass. These experts provided important feedback and we shortened and refined the list further. And then we landed on 15 priority indicators, but before even finalizing that, we provided opportunity for public comment on this a year ago for about a month and receiving comments. We integrated comments on wording, on tools, on measures. And while we still had 15, it did have many changes as a result of that comment period. And we have our final list of 15 indicators across water, sanitation, hygiene, and menstrual health. So we feel confident that we are now have some sensitive, responsive, gender-specific indicators that can complement the existing 6.1 and 6.2 indicators that the JMP is already reporting on. And before I hand it over to Rick, who will share information about some of the learning that we already have with current data, a few more points I want to make about the document. So we have one section called Key Considerations in the introduction section. Now, in that section, we make some important points about these indicators. First, these are priorities, and as such, it's not an exhaustive list. We realize more could be measured, but we have to prioritize to make it feasible to measure data and report it regularly. This is in the context of the home or the household more specifically, so not workplace, schools, or institutions, though that is also a need. Most of the indicators are at the individual level. There are measures that are proposed for all indicators. Some of them, but not all, of the recommended indicators can leverage existing data, which is fabulous because we know a lot of this existing data will be also regularly collected into the future. However, some of the measures have not been fully tested, and that is something that we need to continue to do. These indicators that we present are intended to complement, but not to replace the indicators 6.1 and 6.2. They're also not intended to replace anything that countries are already using to monitor the work that they're doing in their own countries. And finally, these data can be combined with various other data, not only gender, but age, disability status, for more intersectional analyses. I'm just going to walk you through what we have for the indicators themselves. For each indicator, the document is set up so that, for example, with water supply, and I'll use the example of this indicator called W3, W standing for water, sex and age distribution of primary household water collector. So the indicator is noted, and below each indicator, there is a succinct amount of text that justifies or provides background evidence to the indicator and why it was chosen. Next, for each indicator, we have a table that has a formal definition of the indicator, information on the numerator, the denominator, the preferred data source and type, whether or not the survey items themselves have been validated, whether there is current data available, and if we are aware of any efforts to collect data in the future. Below that, we indicate the specific survey items that are needed for reporting against the indicator. And then we have some additional information about measurement and data collection, as well as analysis. So this is all a starting point for each indicator for people to take up the document and use it as a resource. So with that, I'm going to turn it over to Rick, who's going to start talking about what we already know about some of the data for some of the indicators.
Thanks so much, Bethany. So I'm Rick Johnston. I lead the WHO side of the JMP, and Bethany's described the process, and I'm now going to walk through some of the different indicator groups and highlight where we have some data to share. So the report identified 15 prioritized gender-specific indicators, and more than half of them, 8 of them, relate to water supply. So they're prioritized indicators about the ability to meet basic needs, about time and labor, and safety and freedom from violence. Today, I'm just going to focus on the time and labor, where there are actually 4 related indicators, one about who is responsible for collecting water if it's not available on premise, and then 3 about the amount of time spent by those people. So on the next slide, you can see that the JMP last year had a 2023 report with a special focus on gender, and we looked at data that were already available. And one of them was this indicator W3 about responsibility for water collection. Now, household surveys have been collecting data on this indicator for nearly 20 years, both the demographic and health surveys, the DHS, and the multiple indicator cluster surveys, the MIX. They've also been collecting data on the amount of time spent per trip. So with that, we had enough data to look at global and regional trends. And we could see at the global level that about 63% of households that need to collect water rely on women to do that, and another 7% rely on girls, so that you could say 70% of that work is being done by women and girls. Men are collecting water as well in about a quarter of cases, and in fewer cases, boys are collecting water from outside the home. So there's about 1.8 billion people globally then who live in households where this water collection needs to be done. There are some interesting regional differences. If you look at sub-Saharan Africa or Central and Southern Asia, you see a very similar distribution to the global one, but you see a higher proportion of households that need to collect water, 45% in sub-Saharan Africa and about a quarter in Central and Southern Asia. In the other 2 regions shown here, it's actually the men who do the majority of water collection, but there's also a lot less water collection going on. Only 12% of households in Northern Africa and Western Asia, and only 3% of households in Latin America and Caribbean need to collect water. Now, Bethany, if you'll just click, you'll see a figure from the JMP's 2008 report when we were just starting to get data on this responsibility issue. And it's really kind of shocking that that distribution is almost exactly the same today. In 2008, we found that 71% of households relied on women and girls to collect water where water collection was needed. But that doesn't mean that there's been no change. And if you'll click once again, you'll see that actually the number of people who need to collect water has reduced a lot, even while the population has increased by over 1 billion people between 2006 and 2022, which are the years that those reports really focused on. Still, the proportion and the number of people who don't have improved water supplies on premises has changed a lot. The proportion has gone down from 31% to only 21% in 2022. And that means that there are fewer households, there are fewer people living in households where water is collected by women and girls. I think there's one more animation here. That number has gone down by about 300 million people between 2008 and 2023. So this is a nice example of an indicator that we do have that actually can be disaggregated by age and sex. But still, it doesn't tell us how much time is being spent on water collection. So the next slide gets into this indicator W4. And in order to measure that, you need additional information. Just knowing who's responsible and even how much time per trip they take isn't enough. But starting in 2017, in the 6th round of mixed surveys, they added a question about how many trips that person had made in the last week. And then you can multiply those together and see how many minutes per week or minutes per day are being spent by different people within the household. So the graph on the right shows data from about 30 countries where we have data on this now. And on the right side, in light blue and very light blue, you see the amount of time spent by women and girls, and on the left, the time spent by boys and men. And it's clear that especially as you get to the bottom of the graph where the time burden is heavier, it's disproportionately borne by women, to some extent girls, but especially women in sub-Saharan Africa and in rural areas. On the next slide, we'll show the same data, but summing them all together. And we can see that of the 57 countries where we actually had comparable data, first of all, they're mostly in low and middle income countries. But if you add up the amount of time spent by women and girls in those countries collecting water, it adds up to 250 million hours per day collecting water. But we consider that as kind of a minimum level because there are a lot of countries where we still don't yet have this data. We also know that men spend significant amounts of time collecting water. In these 57 countries, they spent about 75 million hours per day, which is just a little bit less than a third the amount of time spent by women and girls. Now, India, of course, is a very big country. It's about half the population of these 57 countries, which explains why it's about also half of the time burden faced by women and girls. Let's turn next to sanitation, where there are 3 priority indicators. There's one about the ability to meet basic needs, and then 2 about safety and freedom from violence. Now, we don't have direct data on the proportion of sanitation facilities that are clean, private, and safe, as called for in this priorities indicator. We don't have that at the household, much less at the sex and age disaggregated level. But on the next slide, you can see that we do have quite a lot of information on shared sanitation, which we call a limited sanitation service in the SDG framework. And shared sanitation facilities get a little bit at this aspect of privacy. And we see that globally, there are quite a lot of people, 570 million people, who still used shared improved sanitation facilities in 2022. The majority of them in urban areas, and again, the majority of them in sub-Saharan Africa. And we know that privacy or sharing is a proxy for privacy and safety because in the multiple indicator cluster surveys, they also ask separately of men and women how safe they feel walking alone in the neighborhoods after dark. So if you click Bethany, you'll see that among households that are using limited or shared sanitation facilities, men are much more likely than women to report feeling very safe. Those are the ones under the line, walking after dark at night. For instance, in Belarus, men were 4 times as likely to report feeling very safe as women were. And above the line, the X's, you can see respondents who said that they felt very unsafe walking at night. And there were far fewer people reporting that, but it was much more common among women than men. So we can consider that shared sanitation then represents a gender relevant indicator, even if it's not sex disaggregated. Let's turn next to hygiene, where there are 2 priority indicators recommended. They're both about bathing locations, one about if those locations are private and safe, and another asking if people have felt fear due to being harmed or assaulted by someone when they were using those bathing facilities. Now, globally, we don't have harmonized indicators or data around bathing facilities. In our 2023 report, we tried to compile examples of data that exist, but it's hard to compare them because they're using different definitions. Still, I think we're going to be seeing greater alignment in the future. The new round of mixed surveys, the mixed 7 module, includes a standardized question asking about if there is a bath or shower in the dwelling, yard, or plot, and if there is, if water is available there. And the mixed 7s are just being rolled out now, but we anticipate that they'll probably be fielded in at least 50 countries over the coming years. Finally, let's turn to menstrual health. There are 2 priority indicators for menstrual health, both related to the ability to meet basic needs. The first one is about having a space at home that's clean, private, and safe to change menstrual materials during individuals' last menstrual period. And then the second is about sufficiency, asking if people felt that they had enough menstrual materials to change as often as they wanted. And this is another case where these indicators are really emerging, and we don't have a lot of countries that have collected national data on this, but data coverage is increasing. And we're heartened that in the new Mixed 7 module, there are 6 questions asked about menstrual health. Also in the new DHS module, there are several questions asked about menstrual health. So we'll see data coverage increasing here. And 2 of the questions included in MIX are closely related to those 2 prioritized indicators, MH1 and 2. MH1 refers to having a space in the home that's clean, private, and safe. And it's hard to collect all that information at one time. So this question here in the MIX focuses on privacy. Did you worry that someone would see you while you were changing menstrual materials at home? But apart from those 2 prioritized indicators, there are 4 other indicators that are quite interesting about participation in various activities, about the ability to reduce menstruation-related pain, about feeling comfortable seeking help if needed from a healthcare provider, and the last one about awareness about menstruation before menarche. So I think in the future we'll have a lot more data on menstrual health among women and girls aged 15 to 49, which is the target for this module in the MIX survey. Now, that's a limitation because we'd really like to know about adolescent girls and girls younger than 15. So one possibility or one approach to gaining data on them is to look at the school setting. And there is a separate prioritized list of indicators for menstrual health and hygiene, a more expansive list that lists 21 indicators for adolescent girls with attention to school settings. And we used this list to guide our report that came out a couple months ago on washing schools that had a special focus on menstrual health. On the next slide, you can see the list of the 21 indicators. I'm not going to read through them. They're very small, but just wanted to highlight that we tried to find examples of existing data for each of them, and where possible, we included a figure in the report. For many of the indicators, these are emerging, and we only found a few cases of national data that were even close to the priority indicator and often not matching it exactly. But some indicators are fairly well represented, let's say, including the one about having improved sanitation facilities that are single sex and usable at the time of the survey. That's part of SDG 4, so we have high data coverage for that one. Then on my last slide, I just wanted to share some of the highlights from that report from the 30 countries that did have national data, especially about providing menstrual health education. We found that only about 2 in 5 schools globally do provide menstrual health education. It's important to note that this is not only an issue in low and middle income countries, even in high income countries, it's not anything like universal. And then around disposal bins for menstrual waste in girls' toilets, only around 1 in 3 schools globally were found to report having such bins. And there's some regional variation there too, with only about 11% of schools in sub-Saharan Africa having bins for disposal of menstrual waste in girls' toilets. So with that, I think we're going to move now to hearing from a set of gender experts, and I'm going to hand back the microphone to Aidan to introduce each of our gender experts.
Thank you very much, Rick, and to Bethany. I think that was an excellent overview, and now we're going to kind of deep dive into hearing reflections from colleagues who can really kind of give a synopsis on the value add of this work. So first, we'll call on Maggie Kossida, and she will reflect on how this work that was introduced just now contributes to the broader IMI SDG work on gender contextualization from her vantage point in UN Water. Over to you, Maggie. Thanks.
Hi, good afternoon or good morning. Thank you very much, Aidan. First, I would like to just say congratulations for this very detailed work, and thank you also for the opportunity to reflect. From my view, the suggested WASH-related gender-specific indicators are perfectly aligned with the wider concept adopted by the IMI on how we can contextualize gender within the SDG 6. They capture the relevant policy objectives of equal opportunities, such as the ability to meet WASH needs and access to resources, equal benefits, shared responsibilities, etc. And they have the ability to reflect on impacts and the gender-sensitive actions and measures or the lack of them. As such, I believe that these indicators serve as vital tools for identifying and addressing gender disparities, ensuring that WASH management policies are equitable and inclusive, and supporting the achievement of SDG 6. For example, like the time spent by women and girls in water collection highlights how inadequate access to safe water can limit their opportunities for education, employment, and leisure. And obviously, there are other examples. The indicators on access to safe and private sanitation facilities are important, and so on. So, as I mentioned, these WASH gender-specific indicators contribute significantly to the broader goals of the IMI SDG 6 for contextualizing the gender and water nexus. And here I would just like to touch on the fact that the IMI approach for SDG 6 gender contextualization is not just about disaggregating existing data by sex, but it is also about developing and adapting new gender-sensitive metrics and indicators that can support the identification and analysis of gender aspects and inform national policies. And so to give you a bit more info about the IMI activities, gender-specific indicators have been developed for each SDG 6 target and are prescribed under a wide framework, the so-called assessment framework. I will put a link on the chat for the people who want to see the framework. These frameworks include a lot of indicators, about 130 gender-specific indicators, which focus on the different gender roles, responsibilities, opportunities, and so on, across all SDG 6 global indicators. And they aim to capture the gender disparities and support gender-responsive policymaking. And of course, the WASH indicators presented here today are included in the framework. The framework has been tested with pilot countries, namely Brazil, Senegal, Philippines, and the state of Palestine. And the purpose was to draw conclusions on the overall feasibility of these indicators to support national or subnational policy needs. The testing involved the assessment of each gender-specific indicator against a common set of criteria, touching on data availability, feasibility of collecting data, relevance, added value, representativeness, and suitability. So it was concluded, as I guess you draw a similar conclusion here during your work with the WASH indicators, that some gender indicators are more relevant and feasible than others, based on the country's specific context. But it was also concluded that despite the clear need for gender-specific indicators, several challenges persist, such as the lack of data, technical expertise, resources, and institutional support. However, there are also substantial opportunities for advancing gender contextualization. And with this in mind, the IMI SDG has now moved to phase 3, which is rollout and capacity development, focusing on one hand on the promotion and awareness of these indicators, but also on building and strengthening the technical expertise within the countries and fostering multi-sector partnerships that can offer a pathway to countries to address the challenges of gender contextualization. So just to conclude, I feel that the development of gender-specific indicators for WASH is a crucial step towards the broader goal of gender contextualization within the IMI SDG 6 framework. These indicators not only provide valuable insight into the gender disparities, but also contribute to the reduction of gender inequalities and the promotion of inclusive water and sanitation management. So I'm very happy to see the conclusion of this work. And I would also like to say that elements of this process, followed by JMP and Emory, have been invaluable inputs to the IMI process. So also thank you for this. Over to you, Aidan.
Thank you so much, Maggie, for those very valuable insights. And we're really happy to hear the value add to IMI. So we're going to move next to Janala Chipungu. Janala is with the Center for Infectious Disease Research in Zambia and has been actually involved in this process. So we'd love to hear, Janala, about the kind of your reflections on the key technical challenges discussed by the expert group and any opportunities you see for moving forward with these priority indicators. Thank you.
Thank you, Aidan. It has been a pleasure being part of this process and really lovely to see the dissemination happening right now. I think what I'd like to start with is just a mention of how when we come to country-specific data at the national level, it's very easy to fall into measuring objective measures or more physical components of water sanitation and really taking the numbers when it comes to the number of toilets that have been constructed, the number of boreholes that have been drilled, or the number of piped water systems that have been constructed. But when we think about gender, what this initiative offers is an opportunity for us to include more abstract measures, such as time and labor and safety, safety and freedom from violence, that really is not easy to add into at a national level. And so this does provide a huge opportunity for national governments to measure gender-specific indicators and leverage on the current systems that are available for measuring the current SDGs. But of course, as we start implementing these indicators and thinking through them, we see a lot of opportunity for research because it raises further questions. And because initially I said it's very easy for us to fall into measuring more physical components, when we look at time and labor and safety and freedom from violence, it raises more questions as to what that means at the country level. And so what it does provide as an opportunity, one, to understand the burden of this problem across genders, but also to provide more opportunities as to really describe what does this mean across the countries. And this then calls for different methods of investigation at various levels, from community, institutional, and national level. Of course, other questions come in for policymakers as we measure these, or as we present these indicators, is what are the implications of the disproportionate burden of WASH on gender? So while we understand that gender is important at the global level, it is something that we also need to prioritize at lower levels and have better understandings of what these differences in burdens are, but also what the real implications of this disproportionate access is. And then, of course, when it comes to intervention development, it also raises further questions around the institutional factors that need to be addressed to create more gender balance in terms of gender-specific measures with relation to WASH. Issues like safety and freedom from violence, these are indicators that beg the question of what type of sanitation locations, facilities should be built and where should they be placed in order to ensure that women, men, boys and girls are free from violence and safe when using sanitation facilities. So it does present a whole a myriad of questions that need to be answered as these measures are being introduced. And lastly, but not the least, I think that right now the world is facing a lot of climate change challenges. Whether we like it or not, as we go into the field to investigate, it is in our faces. Currently, Zambia is going through a drought, and you can't help but think what the effects of climate change are on these gender-specific priority indicators. And so having an opportunity to measure these indicators or observe them over time gives us an opportunity to see how they change as well with the different climatic conditions. Yes, so I'll end here and also just reiterate what Bethany said, that we also still need to test these measures. As much as we're proposing these measures, there's still a lot of room for more research to test and validate these measures. Thank you. Thanks
so much, Janela, and I liked how you raised the issue of policy implications at various levels for that this work highlights, and it's a very nice segue to our next reflector on the work, which is Albert Motivans, who's the head of data and insights at Equal Measures. And Equal Measures is working on connecting data and evidence with advocacy and action on gender equality, and as also Albert has also been involved in this work. So it would be great, Albert, to get your reflections on how the indicators can contribute to efforts to assess and impact gender equality broadly, you know, including your own work in Equal Measures. Thank you.
Great, thank you, Aidan. Yeah, again, congratulations to JMP and all those involved in this work. I think this is really an important milestone. And Equal Measures work is really about making that connection. And we see that, you know, amongst our partners working at the grassroots level or even at the national level, this paucity of data. So paucity of data and evidence that can help inform, you know, their advocacy, how they see what's happening on the ground, as well as, you know, the translating into government policies and programs. But they're missing the data, and I think this is a really important first step towards providing the data that could help them to leverage these issues. I think it's really important to kind of think about it, step back, you know, and think about it from the perspective of the constituency. So those working on water and sanitation, those working on gender issues, this is really an opportunity to datafy and provide this foundation of data and evidence that only partly existed before. And I think that's, you know, really critical, because then it allows one not just to see a better picture, but then also to propose plans to suggest ways that funding can be used, you know, to kind of address these issues. When we look at, for example, other sectors that do a good job of datafying their sector, of showing outcomes, having measures of outcomes, like the health sector, you know, we see that that's often where funding will go. It will follow the data and evidence. So I think that's really important. I think what's also really innovative about this work is that it's really unpacking this black box of what happens in the household. You know, looking at gender differentiation within the household when it comes to using resources that I think is missing, and really a kind of a valuable component. And I think that it's bringing out these issues, I think, that was mentioned already by Janella and Maggie about these kind of really gender-specific issues around gender-based violence and about time use that are really critical to other sectors or to other constituencies also working on gender, but in a different area. And I think that can help to bring together these groups in a way and strengthen then the use of the data, and also just make better informed policies all around. I think really one of the challenges now, so this is a key milestone. So there's some very rigorous measures vetted that are based on existing research. They're not created out of nothing, but it's not just an academic exercise. This is really practical and concrete. And the next step really is maybe even the harder part. And, you know, when we look at other initiatives which have sought to address data gaps, like around the Washington group's work on functioning and disability, or on work around measuring learning, you know, it's tough, right? So this is the hard part, is really then, or the harder part, let's say, you know, getting the data used, getting the data embedded into systems, and making it part of the conversation. So how to do that? And I think, you know, there's a role that then women-led grassroots organizations can play, feminist networks can play in helping to raise awareness around the measures, around advocacy campaigns towards governments to build these measures into existing data systems. and as well to use the data in their work, in their messaging, and their advocacy. And I think there's a lot to be said about the WASH approach already, which is very parsimonious, which is very sensitive to the burdens placed on data collectors. That I think is some really good core principles upon which this is based. So I think that's really important. These are the minimum set. This is a priority list of indicators that can go forward. And I think that, plugging into this grassroots networks, again, around these other spaces that are working on gender issues, whether it's, again, gender-based violence or SRHR, sexual reproductive health, or poverty and other health issues. I think there's definitely potential for kind of helping to mobilize groups and drive this forward. Thank you.
And that leads me to our next speaker, Malini Reddy, who's Director of Governance and Service Delivery of the WASH portfolio at Athena Infonomics. And Malini, you've done a lot of work with national monitoring systems. So I wonder if you could build up then on the challenges that you've found in associating with integrating gender-specific indicators into national monitoring systems and how those can be overcome.
Thank you, Richard, and thank you everyone for having me here. I'm going to speak largely from my work in India and Bangladesh. And I think from my interactions with the Ministry of Statistics as well as the Ministry of Water and Sanitation in both these countries, the importance of having gender-specific indicators is recognized. So there is no two ways about it. However, the manner in which the Ministry of Statistics looks at indicators and importance of which indicators could be different from how the Ministry of Water Sanitation perceives the importance. And this is largely stemming from the fact that the Ministry of Water and Sanitation has a very strong service delivery perception, service delivery objective. And hence, their interest in looking at individual level perception data, particularly in private settings, whether you feel safe in your house using facilities, or whether you have menstrual hygiene facilities available in your house, facilities for using for your menstrual hygiene requirements at your house. I think those are not things which are particularly becoming for the service delivery organizations. What they are more focused on is collecting individual level data, yes, for perceptions on public sanitation or public water services. And I think that's a distinction that I observed, and we need to figure out how to bring that in. Because from a decision-making point of view, for a service delivery organization, it's important to have information on public services and how they're delivered, whereas the information on private service facilities can be used for developing awareness and behavioral change programs and campaigns, but not necessarily for improving service delivery. And therefore, that's a distinction I sort of wanted to bring up front as we go ahead. The second point that came forward when we had these initial discussions using the indicators that we have right now is that what are the channels for collecting the data? Janilia also referred to this earlier, that the most of the time, the countries, the data that is available could be at a project level. However, ability to bring all this together is a challenge. So the points that were made, for example, if you look at the context in India, there is a Swachh Bharat mission for sanitation. Then there is Jal Jeevan mission for drinking water. And data is collected on some of the aspects, I would say, I won't say some of the indicators that we have here, but some of the aspects are touching upon some of the aspects, but it is collected in impact assessment studies. So these are missions. So countries have long duration missions. They have substantial funding under them. And therefore, they are monitoring the progress of these missions and the impact of these missions. So the impact assessment studies have information and data. And I think it's very important for us to find ways of getting these indicators included in those impact assessment studies, because there is also a continuity. They will be done at least every 2 years, if not more. And definitely there is an end of the mission, because the end of the mission in the impact assessment is used for the next round of funding, and therefore it's very important. So that's a very good channel, identifying national missions. And also a point that was brought forward not by the national level but by city governments is that there are several international NGOs who are working in the city, and the city also funds quite a few surveys. So there are a lot of surveys and a lot of data which is being collected by programmatic data being collected by INGOs. If we have a uniform set of indicators, the city can actually insist on these to be included by each of these agencies, and they might be able to find a way of using this data, which currently they are not able to use, because each one is coming up with their own analysis. The other channel that that can be utilized quite effectively in India is that for both water and sanitation, there are national level award programs which have been instituted for several years. It's called Swachh Sarvekshan, which is a challenge where cities provide data on their sanitation service delivery aspects, including various aspects of inclusion as well. And it is not just about access, but how the facilities are being used, whether they are safe, whether they are clean or not. And a similar program on water has also been introduced, and menstrual hygiene is also included in the sanitation survey. The focus is, of course, on public and community toilet facilities. There's also information being collected on use of toilets by transgender community members. So I think these are also very important channels for bringing these indicators, for getting the indicators included. And the third very important effective channel is that there are apps for collecting customer satisfaction for sanitation and public services in general. And every city is expected to promote this app and get its citizens to respond to the questions. And that is also given considerable amount of weightage in these awards programs. So so this is also another a great channel where these can be included. Only thing is that the orientation that currently exists is more in terms of, are you receiving this facility, rather than are you worried that you will not receive? So that is something that one has to work around and see, how do we sort of frame this question? I think one big challenge that was brought about in the context of Bangladesh was that in the absence of having many national level data collection channels, if one has to do this data collection, then identifying a representative sample is something where they express they would require some guidance to be included in the indicators notes as well. And I think they expressed that that would be good to get some clarity on.
Yes.
Thank you, Richard. That's all from my side.
Thanks, Malini. And at the JMP, of course, we're focused more on global and national scale data collection, but you're absolutely right that there are opportunities at the city scale or the local scale that might make use of things like crowdsourcing and apps to really get some granular information. And I think India really has been so impressive in both having these flagship programs and having sound monitoring systems around them, including those impact assessments. And I know that the leadership is very keen to show that these programs have big gender impacts. For instance, Jal Jeevan bringing water into the home, reducing the burden of water carriage. So yes, if we could get some of these measures into those impact assessments, that would just be fantastic. I hope that people are going to be able to stay a few minutes past the hour, because I am seeing that we're going to go late, but we still have some great reflections coming. So I'm going to now invite Petunia Ramunenwia from South Africa to reflect on the priority indicators and plans for piloting those in South Africa. Petunia, over to you.
Thank you very much, Richard, for the introduction, and let me pass my fraternal greetings to everyone on this webinar. And let me say all protocol observed to save time. I want to first applaud the team that has been working tirelessly since 2024 to come up with this indicators for specifically for gender, since this is long outstanding matter. And I think with the work that has been done, we are very much going to be very much involved in ensuring that the implementation takes place. For gender transformation in the WASH sector to be realized, we just need to ensure that we consider all the interpersonal connections, the relationship that exists while we are addressing all the societal ills that are there. With us in South Africa, we do have the policies in place, the political will is there. What we just need to improve and strengthen is how we implement the gender transformation. And what we are also emphasizing is that as much as we're dealing with the gender transformation, that gender should also be inclusive of persons with disability and the youth. It should just not be about women. The webinar said that we are here to launch, but having listened to the previous speakers with those who have been involved in the development of this brilliant work, I think one wants to take on the point around how best we then implement this. Looking at those 4 categories that were presented earlier for the indicators, I think that's a huge milestone. And one of the reflections that we're going to be doing in South Africa is around how that, what that means in terms of the WASH in the schools, what that means in terms of WASH implementation in our complex institutional arrangements that we have existing here in South Africa. As you might know, we've got the Department of Water and Sanitation, which is responsible for the overall water and sanitation policies, water resource management regulations. Then you've got municipalities that are charged with the Water Service Authority responsibility of providing the services directly to the communities. Before that, you also have the water boards, the catchment management agencies from a water resource perspective. So that institutional arrangement needs to as we're dealing with planning, with implementation, with monitoring, with reporting and evaluation, and also ensuring that the data that is required, all those institutions need to ensure that the issues of gender contextualization are addressed fully to be able to, so that we are able to realize the objective of why we started this study, but also to be able to address what is required from the SDG 6.1 and 6.2. As much as we do have a platform of engaging around the 6.1 and 6.2 on in South Africa, we will definitely. be pushing for the piloting. And we are raising our hand to say, yes, we want to pilot, subject to us confirming and finalizing the associated resources that are required in terms of capacity, the financial resources, and all the other related matters. I think I also want to agree with the previous speaker on who mentioned the issues of the issues of climate change that needs to be considered broadly. What does this mean in relation to the gender contextualization, but broadly? But let me also go back to the SDG 6 in terms of the recent reports that have been also shared widely around how far have we progressed and whether we are really going to be meeting the SDG goals as required. And for me, that is where the issue around the institutional arrangement, the financial capacity, and the collaboration that has to be there to enhance and do the implementation speedily. The issues of water mix in terms of water resource availability comes into play. And as all the technical people, the social, the researchers are dealing with all these matters, then it's critical that issues of gender contextualization are also emphasized. I know we've run out of time. Let me pause there. I will take further engagement as the questions come forward. Thank you.
Thank you, Petunia, and I appreciate your point about complex institutional setups. Malini also mentioned in her comments the difference between perceptions between the statistics office and the line ministry and the municipalities. I like to think that having a common understanding of gender and WASH and ideally harmonized indicators and definitions and terms could help to decrease the friction between different actors if they could agree on common indicators, so at least there could be some comparability between different data sources. And I do thank everyone for staying a few minutes extra, but I would like to turn next to our colleagues from the Philippines, to Director Josefina Almeida, who is at the Philippines Statistical Research and Training Institute, where the Philippines is one of the countries piloting the SDG 6 Integrated Monitoring Initiative framework, but also is doing so much work on gender and development in the Philippines. So Director Almeida, the floor is yours.
Thank you. So a pleasant day to everyone. First, I would like to extend my appreciation for the presentation and for the great effort of the team in reviewing the framework of the gender-specific WASH indicators. Monitoring gender-specific WASH indicators is actually crucial for the Philippines as it addresses gender disparities, improves health outcomes, and promotes economic and educational opportunities for women and girls. In the Philippines, especially in rural and underserved communities, women often bear the responsibility of water collection and household chores, making inadequate WASH services a gendered issue that limits their participation in education and the workforce. So there are actually several challenges in the country. And one is a unique challenge because we are an archipelago, 2,000 islands that are inhabited, which makes the WASH service distribution difficult in remote and rural areas. And there are frequent natural disasters like typhoons. We have an average of 20 typhoons every year. And this disrupts services and heighten women's vulnerability to gender-based violence in evacuation centers. And another challenge is that there are urban-rural disparities further exacerbate inequalities, as rural and indigenous communities often lack access to basic WASH facilities. And additionally, cultural norms place the burden of water collection on women, while limited government resources and data gaps hinder effective policy making. So I believe that the country, the Philippines, should really integrate gender-specific WASH indicators into national and global monitoring. And one of which is to update national surveys like the National Demographic Health Survey and APIS to include gender-sensitive WASH questions and ensure data is disaggregated by sex, age, and location. And we can also utilize the community-based monitoring system for localized data collection to inform national and global reporting. And since the agency where I am is the Philippine Statistical Research and Training Institute, we have the mandate to provide capacity building. Then we can enhance capacity through training on gender-sensitive data collection and analysis, improve interagency coordination, and align WASH gender indicators with SDG targets. And of course, it would be nice that we can regularly report on these indicators in the national development plans and the Philippines voluntary national reviews, and involve communities, particularly women's groups, identifying challenges and developing solutions, and engage with civil society for monitoring and advocacy. And I hope with these strategies, the Philippines can ensure inclusive and equitable WASH services for all while contributing to global gender and development goals. So that's all for me, Richard.
Oh, thank you so much, Director Almeida. And it sounds like there are indeed a lot of opportunities in the Philippines, and that the Philippines can be an example that other countries could strive to emulate as you integrate gender-specific indicators into these different systems that you've described.
And we're going to build on that actually further with Jeanette. Jeanette will, as Conaf, who's a senior researcher on data and policy in UN Women, and the UN agency really tasked along with ourselves and other agencies to ensure that women and girls fulfill their full potential. So, Jeanette, could you take those points by our previous reflectors a little bit forward, and situating it also in the context of UN Women and its work? Thank you.
Thank you. Well, first of all, let me again echo others in congratulating the teams, the JMP and the Emory teams, on this incredibly important work. You heard earlier that UN Women has been advocating for new set of indicators to monitor Goal 6. Back in 2017, my colleagues at UN Women and I highlighted a critical gap, right? No SDG indicator under Goal 6 was gender specific. In that report, we called for more attention to how poor WASH outcomes impact women and girls, and how gender-based discrimination perpetuates these inequalities. And we've been saying that ever since. As we all know, WASH services are essential for human dignity and health. However, without gender disaggregated data, we only have a partial understanding of how these services or their absence affects different populations. But we also know that the reality of these issues and these barriers is a grave one. More than 800,000 women lose their lives every year due to inadequate access to safe water, sanitation, and hygiene. The 2030 Agenda rightly emphasizes the centrality of water resources for sustainable development. It links improved drinking water and sanitation and hygiene to better health, better education outcomes, and poverty reduction. And both the right to clean water and the right to sanitation are recognized as fundamental to advancing women's rights and dignity. However, to effectively address the unique challenges faced by women and girls in the WASH sector, we need reliable gender-specific data and indicators. These measures are critical for uncovering disparities and for directing us towards solutions, something that I'm really happy to hear other speakers before me speak about, right? So the idea, of course, is that these indicators are not only used to tell us, where we are today on these issues, what the problems are, what the barriers are, specifically for women and girls, but also what the solutions could be. So I really see this as kind of a groundbreaking contribution. These indicators give us the tools to look deeper, not just at access to water or sanitation, but at the quality, safety, and privacy of these services, especially for women and girls. It's a game changer. In many communities, as you heard earlier, women and girls are doing most of the water collection. You heard that really quite large number, and also heard that really it's a minimum because, of course, for many countries, we don't have data. But women and girls spend at least 250 million hours per day on water collection, over 3 times more than men and boys. And that's really quite a powerful statistic. And it also shows you the power of these kind of data in raising awareness on these issues. And so really grateful for the work that JMP is already doing in raising awareness on this. The data available also reveals the immense cost of this burden. Let me just give you one example. In rural Nepal, for instance, a 1-hour increase in water collection time decreases a girl's chance of completing primary school by 17 percentage points. Millions of girls are missing out on education because they spend too much time fetching water. This is just one statistic, one about time, but it's also really indicative of the lost opportunity that millions of young girls face because of these lacks of services and gap in kind of the WASH sector. And the story doesn't stop at time and effort. These new indicators, as you heard, also expose the issue of safety, which often has been overlooked. Many women and girls fear violence or assault while collecting water or using sanitation facilities. This fear isn't just a personal issue, it's a public health crisis and a human rights violation. Without these indicators, these risks would remain invisible. And again, this is why this work is so powerful. These indicators allow us to measure gender-based inequality in WASH access in ways that we previously didn't have and really had no way to really understand the impact that it's having on different outcomes of well-being for women and girls. We can now track these risks and insecurities with this data, with these indicators, and use them to design policies that improve safety, health, and accessibility for the most vulnerable populations. So really, really important to not only have these indicators, but to invest in the collection of the data for these indicators. And let's be clear, these aren't just numbers. This data has real-world implications. And these indicators provide the foundation to build targeted interventions. Policymakers can use these insights to create infrastructure that is not only functional, but also safe, secure, and accessible for everyone. With these tools, governments can hopefully work to reduce the time women spend on collecting water, to mitigate the risk of violence, and improve educational outcomes for young girls by freeing their time, the time they spent in collecting water. So with that, I really just want to congratulate the team on this invaluable contribution. For me, at least, these indicators really are transformational potentially, especially if we can see the increases in the collection of robust data through these efforts. And I think, there's a lot of work ahead of us, but I think this is really an important first start. And again, as I said, we've been pushing for this for some time now and just really beyond delighted to see this coming to fruition. So again, a big thank you to the team for this really important, robust work that, as you heard earlier from Bethany, has been many years in the making through a very rigorous methodological process of consultations with global stakeholders and others to come up with this really important minimum list. And so with that, again, I'll stop here and congratulate again the team.
Thanks so much, Jeanette. Yeah, thank you. No, that was really insightful and touching on the transformational aspect as well, I think was very, very insightful as we all want to push actually for gender transformative programming. And with that, I'd like to call on Lisa. Lisa is Senior Strategic Engagement Advisor at the Center for Water Security, Sanitation, Hygiene at USAID. USAID is, of course, as we all know, a huge funder and advocate for WASH and gender. So Lisa, could you reflect for us, please, on how this work can be integrated into USAID's work moving forward? Thank you.
Absolutely. Thank you. And again, congratulations to the full team. USAID is really proud to have had the opportunity to support JMP and Emory and the rest of the stakeholder group to make this huge contribution, not only to SDG 6, but to the SDGs writ large. I think one of the key points for USAID is that we recognize that SDG 5 is something that all of us need to be contributing to from all of our entry points. Gender is not something that stops at WASH access or education access, and you really can't piece apart a person's life in a way that allows you to address all of their needs through one set of basic services. And, you know, we've heard a lot already this afternoon or morning, depending where you are, evening, about how long we've known as a global WASH community that lack of access disproportionately impacts women and girls. And we've tended to talk a lot about time poverty, missed education, women's participation in WASH activities, but we also know that what gets measured gets done. And I think as we've heard, that includes what gets measured gets funded. And for that to happen, we need a lot more evidence about what women and girls and men and boys are experiencing across their life course in relation to WASH. So these indicators are really important because they go beyond sex disaggregation. So USAID, we disaggregate all of our people level indicators by sex. How many people got access to a latrine, or how many people got access to a water point? But all that tells us is that it's there, and that this number of women and girls and this number of men and boys have some physical proximity to it that suggests they can use it. It doesn't tell us if they're too afraid to use that water tap because of anything from injury to animal attack to sexual violence. A latrine in school in no way tells us whether all women who menstruate have access to a place to change their menstrual materials at any time, not least because the majority of people who menstruate are not in school, and we have to remember that. So these indicators, from feelings of worry to gender-based violence to the importance of simply being clean, being able to bathe, which is another thing we never talk about as a global community. These data points can help us better target our investments, better create policies, and really respond to the fact that people's lives are complicated and they're lived at a local level. And in order to make decisions as a global donor, we need those local data points to roll up into something that's comparable at the global level. For USAID, it's particularly relevant because under US law, we are required to prioritize our WASH investments based on two broad criteria. The first is the need for water, sanitation, and hygiene access in a given country, and JMP provides us with those data and has done for a long time. They're a critical partner of ours. But the other criteria is about opportunities to leverage at a broader scale. And the GLAAS work contributes to that. I saw that was coming up in the chat a minute ago by telling us about the enabling environment. But the other piece, and this is explicitly spelled out in US law, is that we have to look at the opportunity to advance women's equality and girls' education by increasing access to WASH. And to date, we simply haven't had enough data to tell us how we're doing with that, or even to meaningfully include those questions in our selection criteria for our high priority countries, like Liberia, where I'm sitting in today. So under the U.S. Global Water Strategy, which is a whole of government strategy, we have included an operating principle that's focused on meeting the needs of marginalized groups and people in vulnerable situations. And that includes women and girls, but it also looks at other challenges and other people in vulnerable situations, Indigenous people, youth, persons with disabilities. And we have reporting tools that let us track a little bit of our investments and kind of narrative storytelling about which programs are contributing to, for example, women's equality or menstrual health and hygiene from any sector, including WASH. But the data that we have available show that we have made nowhere near enough progress to reach universal access to WASH by 2030, and nowhere near enough progress to meet the targets under SDG 5 on gender equality either. So I will close out just by saying, for us, for USAID, this work is a part of our focus on data for equity. And these indicators are just going to be enormously useful for our project level monitoring, but that's not enough. And the thing that we think is so exciting is that these are our standard indicators that the entire global community can now rally around, whether it's at a project level, a national level, or a global level, so that we can collectively make better decisions that improve gender outcomes through WASH. Thanks.
Thank you so much, Lisa, and for dialing in also while on mission. And I really liked the point you made on that we have so much work to do still, but that this strengthened data and evidence will really help us at all levels, from local to national to global, to really start to move the needle on some of those bottlenecks. So maybe with that, I'd pass back to you, Rick, to reflect on next steps and to close us out. Thank you.
Yeah, thanks so much, Aidan, and thanks to all the speakers. That was really, really inspirational. As far as next steps, I can say from the JMP side, we see this, as more of the beginning than the end, the end of one process, but we're definitely committed to using the platform that we have. We put out reports every 2 years on WASH in households, and then in the other years, WASH in schools and healthcare facilities, to highlight gender-specific, gender-relevant data where data exists. I'm sure that this water carriage one is going to continue to be featured prominently in our future reports. And I think we're just excited to help fill those data gaps, to advocate for uptake of the new indicators, for countries to use this new Mix 7 module. I think for countries that aren't using Mix, we have more challenges because there's just a nice package there. But we mobilize our networks to advocate for inclusion of these indicators in different types of data collection instruments. As the JMP, we're particularly interested in nationally representative data, but I think we recognize that there can be really valuable experiences learned through data collection at smaller scales, whether that's at a municipal scale or a project scale. I see lots of good possibilities. Bethany, can I pass over to you for some final reflections?
Thanks so much, Rick, and thanks to all the wonderful contribution. I was taking a lot of notes. From the research community side, just to actually start with echoing what Janala was talking about, which, these data are important because they reveal inequities and challenges that we can investigate farther. They're just the tip of the iceberg, and it can prompt action not only for practitioners, policymakers, and decision makers, but also for research, which I think is really, really critical. We still have some more work to do in regard to these indicators specifically related to measures. We need to validate several of the measures to make sure they're reliable. We want to pilot them and to start collecting that data. And of course, we need to be reporting. And so I would encourage others in the research community, if they're interested, to contribute not only to using these measures, but also once we start learning more to digging deeper, as well, as Janala said. And then finally, to governments and donors, I think that there's a role for everyone to play as well. For donors, I love that Lisa from USAID was noting the importance of supporting these efforts and how vital it is for data collection. And we encourage governments to start taking up these indicators. We had wonderful contributors in the morning session from South Africa and Philippines who were talking about their intention to do just that. And we were more than happy to talk with anybody interested, whether in government, project, or otherwise, in taking these on. So with that, I thank you. I want to, before passing it back to Rick, also just note, I know this is really small, more information of all these names are also in the document itself, and the priority indicator document, but a huge thanks to all that have contributed in the multi-sector, multi-phase, multi-stakeholder process along the way. It's been a huge, huge effort. Back to you, Rick. Thank you so much.
Thank you, Bethany. It has been a huge effort, and it's nice seeing it come to fruition now. This specific piece of work was made possible by the support of USAID, but more generally, the JMP is grateful for the support that the different bilateral donors you see listed here give to us, which makes this kind of work possible. With that, our last slide is a bunch of QRs pointing to the different materials that we've covered in this webinar. And with that, I'm going to close the webinar, but just leave this slide open so anyone interested could take a quick picture. Thanks so much to all of our speakers and participants. Bye-bye.